The sky is falling, the sky is falling. That is what you will hear a lot of from various people when it comes to Medicare Advantage. You could hear it from your neighbor, the news, a politician, your financial advisor, a radio talk show, and some agents even on YouTube. Now, I don't have my head in the sand and certainly realize that Medicare Advantage is far from perfect. Just look at some of these videos that I have done about it. The 3 main risks, the 3 main rewards. Should you be scared of Medicare Advantage? My client called an 800 number and lost $3,276. Uh-oh, you just got a Medicare Advantage plan. Now what? And I see the headlines too. Just look at some of these. So it's clear that Medicare Advantage is far from perfect, but neither is original Medicare and a supplement. Hi, I'm Chris Prang, the Medicare analyst. I am a licensed agent in 16 states. Maximizing your Medicare should be important to you. My goal is to help people like you make a wise and confident decision about all of your Medicare choices so that you can protect your income, your assets, your savings, and your health. Before I get started, if today is your birthday, Henri Frédéric Amiel said, "To know how to grow old is the masterwork of wisdom and one of the most difficult chapters in the great art of living." Unquote. There are certainly plenty of Medicare Advantage naysayers out there. The question is, are they right, and should you listen to them and base your health insurance decisions on them? What I'm going to try to do is clearly lay out the downsides with Medicare Advantage as well as the upsides with Medicare Advantage, and then hopefully give you some ideas as whether or not you should consider Medicare Advantage. Hopefully that sounds good to you. And near the end, I'll let you know what most of my clients are choosing for their Medicare coverage and what I am personally planning on choosing in just another 4 years when I turn 65. First, just in case you aren't familiar with Medicare Advantage, let me briefly summarize what it is and what it isn't. Number 1, the current version has been around since 2005. 2, it is an alternative to original Medicare run by private, publicly traded insurance companies. It is not Medicare. 3, Medicare Advantage replaces original Medicare as the primary payer for your insurance claims unless you end up on hospice. 4, it is funded by and overseen by Congress and CMS. CMS and Congress make the rules and the insurance companies have to abide by them. 5, Medicare Advantage has to cover everything original Medicare does, but, and that's a big but, they can deny coverage if they deem it unnecessary. Original Medicare is way less likely to do that. Number 6, CMS reviews the insurance company's plans each year and then either approves them or sends them back to the drawing board. So if there's a problem with a plan submitted by the insurance company, it is CMS's responsibility to find it, point it out, and make sure it's fixed. Number 7, you still, in most cases, pay your Medicare Part B premium. 8, it is not a secondary policy like a Medigap or a Medicare supplement plan. 9, they can and almost always do include extra benefits like dental, vision, hearing, gym memberships, etc., etc. 10, and the premiums are often very low and in many cases $0 per month. So what are the main and most concerning issues with Medicare Advantage? Number 1 is networks. You will have to deal with provider networks. With original Medicare and a Medicare supplement, there are no networks unless you get a Medicare Select supplement, which I advise you don't. 95 to 97% of providers accept Medicare assignment. With an HMO, Health Maintenance Organization, in most cases, you can only use providers in the plan's network unless it's an emergency or urgent care situation. You will be extremely restricted when it comes to using many specialty hospitals. With a PPO, you can use a provider in or out of network. If you go out of network, the provider has to bill the insurance company and not you. If you go out of network, in most cases you will pay more, but on certain services you will actually pay less. There is a special type of PPO called a passive PPO or an open network PPO. This means you pay the same copay or coinsurance regardless of whether the provider is in or out of the network. This is the ideal Medicare Advantage plan if you can find it and it makes sense. While you pick a plan for a year, the provider can drop out at any time, and this is much of the bad news that you see with large hospital groups dropping out of Medicare Advantage network. So dealing with networks can make things less flexible and less convenient. It just depends on where you live, who your doctors are, your need for a specialty hospital, and how much you travel. Many people are perfectly fine with strict networks. Let me give you a story. A family member has a Humana HMO. He needs cataract surgery. The local network ophthalmologist has bad reviews. The out-of-network provider has great reviews. So where do you think he wants to go for his cataract surgery? Can you blame him? There are other ophthalmologists that show up in the network, but the facility they practice in isn't. So that's a problem. Number 2, the financial risk exposure. As I like to say, you buy insurance to protect your income, your assets, your savings, and your health. Notice I have health last. Insurance doesn't make you healthy. The purpose of health insurance is to cover excessive medical costs and treatment. As I pointed out in other videos, the number one way to save money on your health care and your health care insurance is to be very proactive in taking care of yourself physically and mentally. You can, in most cases, for most people, radically reduce the likelihood of excessive medical costs and treatments by simply doing a few things. Give up or don't take up bad lifestyle habits like smoking, drinking, drugs, and that includes some prescribed medications, sitting excessively, etc. Eat really healthy, like more greens, vegetables, fruits, nuts, whole grains, good protein. Fast and reduce excessive calories. Exercise and move more. Walk more, stretch more, build your muscles more. Have a positive mindset. Get some good sleep. The biggest advantage of Medicare Advantage over just original Medicare is you have a cap on what comes out of your pocket. Whereas with original Medicare, sky is the limit unless you have a Medicare supplement or Medicaid or some retiree coverage like TRICARE, FetBlue, etc. So unless you have Medicaid that covers your deductibles and copayments, or perhaps financial assistance from your local hospital, then having a max amount of pocket is a very good thing. The key is finding a plan with the lowest maximum out of pocket. Ask yourself this: would I rather have $2,000 worth of dental and be on the hook for $9,300 out of my pocket, or would I rather have $500 worth of dental and only be on the hook for $4,000 out of my pocket? Number 3 issue, prior authorizations and benefit denials. This gets all the press. Due to Medicare Advantage being more managed care, there is a greater chance of dealing with prior authorizations or prior approvals and benefit denials. Despite all the misleading headlines, the scare tactics, YouTube videos about people dying, people being kicked out of skilled nursing, here are the facts. Are you ready? The average number of prior authorization determinations per Medicare Advantage enrollee in 2023 was 1.8. 93.4 of all prior authorizations are approved right out of the gate. So only 6.6% are denied. Now get this, only 11.7% of the denied prior authorizations were actually appealed. Why is that a big deal? Because 81.7% of those ended up getting approved. So if every prior authorization denial was appealed, then in the end, only about 1.2% of prior authorizations would be denied in whole or in part, and that is not that bad. Prior authorizations can and do serve legitimate purposes to prevent unnecessary and or dangerous treatment and sometimes fraud from bad doctors doing procedures that don't need to be done only so they can profit. Now, before you start typing nasty comments, let me make some things clear. I am not discounting the hardship that some people and their families have incurred due to a medical service being denied coverage. I have had several clients be in this boat, and it is not pleasant. There have been times when people were denied coverage when they legitimately needed coverage or a drug. There should be a better way to make sure patients are truly being helped and improving, and if so, then care and coverage should continue for the allowed duration. At the same time, the insurance company won't continue paying if someone is not improving or likely to improve, and that does make sense. Last thing on prior authorizations, Congress and CMS are taking some measures to make the situation better, so hopefully things will improve. I can tell you that I have had many clients on Medicare Advantage plans come down with cancer or stage 4 kidney failure, also known as end-stage renal disease, and all of their treatments were covered. Bottom line, it's an issue for sure, but it is blown way out of proportion. So what are the positives or the advantages with Medicare Advantage that people can take advantage of? Well, here's what it is not. It is not the silly grocery card. Number one, the flat out economics of Medicare Advantage. What do I mean by that? I mean the potential, and I do emphasize potential, for significant financial gain. Now, as you recall, I mentioned that the second issue with Medicare Advantage is your financial risk exposure. If you have a major health issue, then you could be on the hook for thousands of dollars out of your pocket. This financial gain comes from the following. Number one, the MOOP, your maximum out of pocket, your financial protection. All Medicare Advantage plans cap your Part A and Part B out-of-pocket costs. The median MOOP for 2025 is $5,400. Whereas with original Medicare and no Medicare supplement or Medicaid, then sky is the limit. 2, low to no premium. With many plans offering a zero premium and with the average Medicare supplement premium being about $217 per month, you can see there is a significant premium savings. Plus, you have the savings of not paying a premium for a standalone Part D plan, which has an average of $46.50 per month. So that gives us a total of $243.50 per month in potential premium savings. But to be conservative, let's just say the average savings is $200 a month. Well, that's $2,400 per year, or over 5 years, it's $12,000, and over 10 years, it's $24,000, and over 15 years, that's $36,000, and over 20 years, that is $48,000 in potential premium savings. And it doesn't take into account the Medicare supplement premium going up 10 to 15% per year. So in reality, the premium savings will be even greater. Now, what would happen if you invested those premium savings into something conservative and earning just 5% per year? Well, after 20 years, that $2,400 premium savings per year would give you $86,953.14. That might come in handy because in 20 years, you will be 85 if you got Medicare Advantage or Medicare at 65, and that could possibly go towards some long-term care. Which means your premium savings being invested would give you an average annual financial benefit of $4,347.66. The odds of you having that much in copayments per year, year in and year out, are pretty slim. Now, of course, if you have significant long-term health issues, then obviously the premium savings is going to be much different when you start having to pay lots of copayments. Number 3, the extra benefits. Most Medicare Advantage plans have $2,000 to $5,000 or more in extra benefits. This would be like dental, vision, and hearing coverage. It would also include gym memberships, over-the-counter allowances, and of course, the beloved grocery card. How much does that save you out of your pocket? Let's just say you can save $2,000 that you wouldn't have to spend out of your own pocket for these services or benefits. Number 4, Part B give back. Some plans offer a Part B give back, meaning that they cover part or all of your Medicare Part B premium. This benefit does come and go and fluctuate from year to year and from plan to plan, but another potential financial positive for Medicare Advantage. Right now, the Medicare Part B premium is $187 per month, and some plans cover the whole thing or some just cover parts. So as you can hopefully see, the potential for significant long-term financial gain is quite good and appealing to many people. Whether they or you take advantage of it is another thing. But keep in mind, if you develop a serious health issue like cancer or end-stage renal disease, you will have likely been better off with a Medicare supplement plan. Though your treatment for serious health issues doesn't typically last more than a few years, having to pay upwards of $10,000 out of your pocket each year could be devastating to deal with. Okay, other than the economics of Medicare Advantage, what are some other positives? Number 2, the extra benefits. As already mentioned, the fact that you have dental included increases the likelihood that you will see your dentist and take better care of your teeth, thus potentially saving you more money down the road if you hadn't taken care of your teeth. Good dental care and regular visits to the dentist do far more than keep your teeth looking nice. They play a vital role in your overall health. Here is how. They can protect heart health, they can help manage diabetes, early detection for serious diseases, reduces the risk of respiratory illnesses. Then we have gym memberships. This is a great perk if you are fortunate enough to have a club nearby. Utilizing a gym membership should keep you in better shape. I certainly hope so. Plus, exercise is proven to reduce your risk of serious health issues. So if you have the gym membership, why not use it? Number 3, maybe better care. In some cases, and according to some reports, Medicare beneficiaries receive better overall care and have better healthcare outcomes. This is primarily due to the insurance company managing your care and sometimes nagging you, quite frankly, to get your preventative services done, like cancer screenings, flu shots, etc. These preventative services can lead to early detection for cancer. I've heard many times from clients that received a call from the Medicare Advantage company reminding them about their available cancer screenings and were even helped with getting it scheduled and then found out they were in the early stages of cancer. One thing is for sure, neither Medicare nor your Medicare supplement company will call you to remind you to get your preventative services done. The Nurse Advice Hotline. Many plans offer a 24/7 nurse advice hotline for you to call about a potential health issue, medication question, etc. Chronic care support. If you are someone with a chronic condition like diabetes, COPD, congestive heart failure, then you may have access to additional benefits or plan options to help you manage your chronic condition. Number 4, it is an all-in-one plan. A lot of people like the fact that with Medicare Advantage, you have one plan that covers you at the hospital, Part A, the doctor, Part B, and the pharmacy, Part D, with just one card and one company to deal with. While that's not a great reason to pick a plan, it can be a nice benefit to some people. So how about some survey results? 95% of Medicare Advantage beneficiaries are satisfied with their healthcare quality, and 97% are satisfied with the ease of getting to the doctor. On a personal level, after 15 years in dealing with several thousand Medicare beneficiaries, many of them choosing Medicare Advantage, I can tell you flat out that the vast majority have been perfectly fine and perfectly happy. Should they have all gotten it? No, they shouldn't. I try to advise otherwise. I can't make people choose what they're doing. But the vast majority have done very, very well on Medicare Advantage. Let's keep going. Medicare Advantage enrollees report over $2,400 in savings compared to beneficiaries in fee-for-service Medicare. That was pretty close to what I came up with. Medicare Advantage beneficiaries experience more preventative care and screenings and lower rates of avoidable hospitalizations compared to those enrolled in traditional Medicare. A 2023 survey revealed that Medicare Advantage and Medicare Supplement enrollees have about the same level of satisfaction with their plan. Kiplinger reported, quote, Medicare Advantage plans get high marks from customers, unquote. Okay, so now it's time to ask some questions. Number 1, who should consider Medicare Advantage? Let's start with those on Medicaid. If you have Medicaid, then you have no need for a Medicare supplement. So why not take advantage of all the extra benefits? Second type of person would be you simply can't afford the Medicare supplement premiums anymore. You do need to be very careful with this one. If you have health issues and frequent providers a lot and can't qualify for financial assistance from your local hospital, then it may be cheaper to pay a high premium as compared to high copayments. You live in an area where there are some great Medicare Advantage plans with lots of extra benefits and incentives. You are willing to deal with the risk-reward of the potential for a large sum of money out of pocket versus the potential for saving thousands of dollars and taking advantage of all the extras. Second question, should I keep my Medicare Advantage? Well, that depends on some of the above and what other Medicare Advantage plan options you have in your area. If you are from one of the states that I'm licensed in, then reach out to me for a review, especially during the annual election period in the fall. You shouldn't keep your Medicare Advantage plan if there is a better one in your area. You shouldn't if you don't have access to your doctors. Number 3, what should I look for in a good Medicare Advantage plan? Your doctors and preferred hospitals are in the plan's network, your medications are covered well, you have a low maximum out of pocket, and it has some decent extra benefits. It comes from an established, ideally large nationwide company like Humana, United Healthcare, Aetna, Cigna. Some of the Blue Cross Blue Shield plans are fine, and typically Kaiser is always okay. So you've hung in here this long, and you may be wondering what most of my new clients are choosing for their Medicare coverage. Well, hands down, it's getting a Medicare supplement. About 40% are going with the Plan N, about 20% are going with the Plan G, and about 20% are going with the high deductible G, and about 20% are going with Medicare Advantage. Now, as for me, providing nothing changes for me in the next 4 years, I'm going with the high deductible Plan G. All right, that is it for today. I do hope that you found this helpful. Bottom line, don't be frightened by the Medicare Advantage Chicken Littles, but also don't be like Little Red Riding Hood and be so gullible that you are deceived by and trust the big bad wolf Medicare agents, the large publicly traded brokerages, the 800 number ads, the telemarketers, and the direct mailers. It is imperative that you do your research, understand the pros and cons of your options so that you can make a wise and confident decision about all of your Medicare choices. If you have any questions about what I have just gone over and when you're ready for my help in maximizing your healthcare and retirement insurance coverage and making a wise choice, again, when it comes to all of your Medicare insurance options and you live in one of the states that I am licensed in, which you can see here, then please feel free to reach out to me either by phone or through one of my contact forms on my website. We will have an open and honest conversation about your healthcare needs and your philosophies and your budget. I will do my best to answer any questions or concerns that you have. Once we determine what's best for you and your unique needs and budget, I will then enroll you in the plan or the plans of your choice and, of course, be available down the road for your support. To stay up to date and to gain more insight on maximizing your Medicare insurance and perhaps your health, then please go ahead and subscribe. And who do you know who might benefit from this info? Please share it with them. I'm Chris Bryan, the Medicare Analyst. Make it a great day.